Hi everyone, this is Mariam. Sorry, I'm unable to be at the clinic, but here's a short video for you guys from the session that I attended at the ASRM 2022. The topics that I will be talking about briefly are adenomyosis and endometriosis, time lost after every unsuccessful embryo transfer, how long should patients wait to try and conceive again after methotrexate treatment for ectopic pregnancy, and lastly, weight loss and PCOS. Let's start with adenomyosis and endometriosis. Some of you might not know what adenomyosis and/or endometriosis is, so I will briefly describe what these terms mean. When endometrial tissue starts growing in the muscle layer of the uterus, it's called adenomyosis, and when that tissue starts growing outside the uterus, it's called endometriosis. Endometriosis could be anywhere in the pelvic area, including ovaries, fallopian tubes, and bowel. Adenomyosis can be diagnosed by a simple transvaginal ultrasound, but MRI is a better and definitive modality for this diagnosis. Moreover, difficult or complex form of adenomyosis is best diagnosed on an MRI. Usually, surgery is not performed for adenomyosis, but if clinically indicated, adenomyomectomy could be performed for localized adenomyomas and to preserve the serosa, but it cannot be fully resected as roots cannot be fully removed. This topic interests us in infertility as it impacts one's fertility, especially implantation, as the fetus is implanted in the endometrium. Endometriosis is a very broad topic in itself, and when we are doing ultrasound, we most commonly see it in the ovaries. But interestingly enough, the most common place for endometriosis is actually posterior to the cervix. Another interesting finding could be an umbilical lesion. Whenever we see an umbilical lesion, first thing comes to mind is an umbilical hernia, but we also need to think about endometriosis. Next topic is time lost after unsuccessful embryo transfer. I personally found this study quite interesting as I never thought about time factor after any loss. This was the first ever study that was done by University of Cincinnati, and as you can see on this table here, the time lost from one unsuccessful embryo transfer could be anywhere from 2 months to 7.5 months. With negative pregnancy test, it's 2 months, and for miscarriages, it's about 4 months on average. Then the study further categorizes by miscarriage type and management that ranges from 3 months to 7.5 months. Next, let's talk about methotrexate treatment for ectopic pregnancy. There are more than 100,000 ectopic pregnancies every year in the United States alone. This next study was done by a resident at University of British Columbia. FDA product label recommends women to avoid pregnancy during methotrexate treatment and for at least one ovulatory cycle after last dose of methotrexate. The medicine is cleared from blood well before 4 to 12 weeks that are required for resolution of ectopic pregnancy and subsequent ovulation cycle. However, some experts and ACOG, which is American College of Obstetricians and Gynecologists, and ASRM, American Society of Reproductive Medicine, they recommend waiting 3 months post-methotrexate. But there is no evidential data that supports this. Therefore, there needs to be more research and data on this topic, which could potentially reduce wait times, which in turn will reduce anxiety and frustration for patients. My last topic to discuss is another very interesting finding, which is weight loss for patients with PCOS. Polycystic ovarian syndrome affects approximately 12% of women of reproductive age. Metabolic inflexibility associated with PCOS makes weight loss very difficult. This study was conducted to determine whether 8-week dietary intervention that included low starch, low dairy diet with face-to-face or web-based nutritional instruction would result in weight loss in women with PCOS, as opposed to standard clinical practice. Please note, standard clinical practice includes recommended calorie intake and exercise frequency, plus metformin if fasting glucose, insulin, or A1C are elevated. Moreover, participants were allowed to eat lean meats, non-starchy vegetables, and low-sugar foods until satiety at every meal. The results indicate that there was a mean reduction of BMI by 2.9 and 2.3 by face-to-face and web-based instructions respectively. There was a significant reduction of A1C as well, as waist and hip size reduction were also noted. This study concluded that low starch and low dairy diet instruction by either face-to-face or via 11-minute web-based video show more weight loss, lower HbA1c, and greater reduction in waist and hip circumference than standard clinical practice. That's all from me. Thank you for watching. If you have any questions or comments, please feel free to email me.